All right, we are good to go. So good morning, everyone. Today is the June 9th. Crazy. It is 10:02, and I am going to call the meeting of the Greater Boroughs Partnership for Health to order at 10:03. The open meeting of the the Greater Boroughs Partnership for Health is being conducted remotely, consistent with Chapter 2 of the Acts of 2025 relative to the extending COVID-19 measures. The public is encouraged to follow along on the posted agenda unless the chair notes otherwise. And members of the public who wish to view the live stream of the recording can do so by going to the Northborough remote meetings on the YouTube link. This meeting will not feature public comment. And with that, members, when I call your name, please respond in the affirmative. So we have Chelsea,
Here.
Jen,
Here.
Anne Marie.
Present.
And then Isabella Northborough here. And then we also have Taylor West from Southborough, and then Maria from Westborough. And then Michaela, our EPI and shared service coordinator. And then Shola, our DPH intern. So with that, we'll go into our first agenda item. So Shola, we are very excited to have you. You are our DPH summer internship intern. So we're very excited. So if you want to kind of take it away and do a little introduction and share your summer project. Oh, you're on mute.
All right. Well, hello everyone. My name is Olushola Alega. You can call me Shola for short. Um, as Isabella mentioned, I'm the DPH intern, and I'm in my second year of my Master's in Public Health program. And this summer, I will be working on the Fostering Youth Digital Wellness Project. So specifically, I'll be working with Northborough Health and Human Services to complete the following. So to create a summary report and presentation that kind of goes over the findings of some research that I'll do concerning social media and youth mental health. And then afterwards, I'll create a toolkit slash resource guide to share with the community as well with the Greater Boroughs community. And also share recommendations about programming and initiatives to improve outcomes for youth mental health. And this is at the end, it will end with the culmination of a presentation to the Greater Boroughs community.
Great. Welcome. Nice to have you.
Thank you for having me, guys.
Yeah, and then part of the project, so there's obviously like survey data that Shola can look at, but if there's anyone either in the health department or your town offices and then community partners that kind of want to do a more like interview type conversation, that is definitely welcomed. I know I reached out to our district wellness nurse at the Northborough Southborough High School just to kind of see what policies are in play or what they've been seeing. So that's an option as well. Just feel free to reach out to Michaela, me, or Shola directly.
I have a few people that will probably be reaching out to you, and
Perfect.
I'll
Perfect.
send you an email as well.
All right. Thank
Thank you.
you.
Any other questions for Shola?
You're going to be looking at the difference in our adolescent population in schools and whether they're allowed to have cell phones during school or not.
It's more specifically on social media use and how that
Okay.
impacts their mental health. And that since mental health social media use, it's everywhere. I think how it also impacts their social life within the school and also their relationships with other students within the school. That will
Mhm.
kind of be part of the interview questionnaire type thing.
Okay.
Yeah.
I know that Melican has the pouches and Trotter doesn't. I don't know about Westboro or Boylston for their middle school, but I'd be curious to see if there's any difference between the Northborough middle schoolers and the Southborough middle schoolers, just given that they do have the pouches in Northborough.
Yeah, and Chelsea, that would be really interesting because they're doing the Metro West Adolescent Health Survey this, I think, October or this fall.
Okay.
So comparing the middle schools, that would be interesting because I know
Mm.
they have added some social media online behavior questions.
Okay. Great. Thank you,
Jed, do you
Laura.
know, does your middle school or any of the schools have any policy or pouches?
I would imagine they do, but I honestly am not sure.
Yeah.
And then for like student devices, do they like block like social media like when you're connected to the school's Wi-Fi?
So one of the people I'll have be reaching out to you is Westboro Connects, and they're more involved with that aspect of schools and over there. So they'll be in touch, but also I'm also going to speak to the school nurse and see what she thinks would be a great match for you. So
All right, thanks.
Chelsea, if
I
you want, we can
appreciate
try and
that.
get a meeting with Shola on the books too. I know Isabella has already reached out to Mary Ellen, and I believe
Great.
you guys are already in contact with her.
Great. Thank you. That'd be awesome.
Perfect. Well, thank you so much, Shola. You can stay on, but we're talking about some fun budget things, or you can log off and start your project.
All right, I think I'll stay on for a few minutes just to see what it's about.
Yeah, absolutely. All right. So with that, I will pass it to Michaela to kind of walk us through our FY26 work plan.
Yes, so I'll pull up the slides. But we'll kind of walk through the FY26 work plan, some of the requirements, and then we'll also talk about the options that we have. Can you all see that?
It's loading.
not yet. There we go.
Yep, we got it.
I can see. Okay. So this is just an overview. At this point, hopefully each of you has had a chance to at least kind of get familiar with the work plan. There's really four primary sections: the PHE grant requirements. So those are the things that we have to do. That's more of just kind of a heads up of what will be coming down the pipeline this year. And then the three other areas, sustainability, performance standards, and electives, are where we get to choose which of these objectives we want to work on in the next fiscal year. And then throughout all of these, the grant has racial and equity themes. So for each objective we choose, we also select a racial and equity theme that has kind of an associated activity. But this is just kind of a reference slide. So for the PHE requirements, there's 5 objectives. These first 3 on this slide are just kind of standard, making sure the grant is maintained. We have an IMA, which ours doesn't have an end date, so we can just kind of should be up to date. And then general requirements for Isabella and I attending the state meetings. And then you'll see that FPHS does have a part on the work plan again this year, but it's more just kind of disseminating the information that we have and utilizing that as a tool throughout the year. So you won't have to recomplete it this year. There will be some other reporting that we'll talk about in a second. Before I move on from these, any questions kind of about these requirements? They're carried over from the previous year as well. Okay. So these 2 other requirements, SAFE 2.0 was passed into legislation this last year. So this is the first year it's part of the work plan. Really, this means that there will be some reporting. It will probably be similar-ish to the CART from what they've talked about, that was done a couple of years ago. So this is just kind of a heads up that I will be contacting you, and there will be some webinars to attend about what this reporting will look like. And then later in the fiscal year, there will be some reporting aspects of it. I think they're hoping that with metric, this becomes more streamlined. But just kind of want to make you guys aware of that. And then the last piece is metric. So throughout the year, the state will be kind of sending out more information to come, but essentially we'll be transitioning from using relevant to using metric for inspectional software. And then there will be some other pieces of this for reporting and tracking purposes. But a lot of it this year is just getting that up and running and coordinating with IT departments and our own internal systems to kind of set up for that. Any questions on this before moving on to what our options are? Okay. So the first section where we can choose how we want to build our work plan is in sustainability. So I've talked with each town at some point kind of in the last month, and based on feedback and kind of listening to where our priorities are as a group and for your towns, these are kind of the three sustainability objectives that feel like they fit best with our goals. The green is one that kind of unanimously came across as something we all want to work on. And the two blue objectives are ones that, also came back as positives, but wanted to kind of talk about which of these fit best. We have to have at least two sustainability objectives. You can pick up to three, but this is the options that we have. So I'll kind of go over them and then we can talk about which of these we want to select. So for the first one, communication and engagement, this is raising community awareness about our group and what we do, and kind of just getting our name out there and making sure people understand what we do. And then for the racial equity theme as a part of this, it would be making materials accessible to a broader audience. We've already started on that this year with a brochure and translating it. So it would be carrying this through and being intentional about communications. The second option is improved sharing of resources. So this would be kind of a carry forward from this year as well in developing frameworks to optimize our efficiency and our kind of communication as a group. So this is more SOPs and maybe more just kind of communicating what those SOPs look like, making sure everyone feels supported and has equal access to resources. And then the third option is community partnership development. So this is kind of doing a mapping and assessment of what partners we can grow relationships with that are currently established or engage with new partners in our communities. And for the racial equity theme on this one, it's kind of making sure we're including partnerships in faith-based organizations, community-based organizations, and other populations that might not always have had access. So now we'll open it up to any questions or discussion on how we want to select these objectives for this sustainability section. Oh, Jen, I think you're on mute. Sorry.
I think I'd learned by now. Do we currently have feedback mechanisms? I know we get feedback, but I don't know. Do we have it like a formal for each activity we have?
Feedback from
From people that are involved with any group or anything that we hold.
You mean
yeah,
like
so
community feedback?
Yes.
So any like the breastfeeding, we did have a survey at the end of it. The Narcan trainings we tried to. So I think this is more like feedback from maybe you all about the services and staff. That's kind of how I'm reading it. I don't know, Michaela, if you know.
I think it's more internal focused, but I think feedback could also be community feedback of like how people are finding out about us and engaging with us. So I think it could be both, but I think this is more phrased towards internal feedback in like regional staff and municipal staff.
See, I think we have great communication with one another. I don't think that's really needed for us.
Mhm.
My opinion. And hold monthly meetings with SSA municipalities. I honestly, I don't think that that is really needed. Do you? Does anyone else?
You mean like this meeting?
Yeah, every month. I mean, we kind of bumped it up to what we really needed anyway.
Right.
Yeah, and I think that is on an individual basis. So I had thought about like we do every other month as a big group, but like in those off months, being able to have one-on-one meetings with each town to kind of see how things are going. But I do think there is good communication. So if that doesn't feel necessary, we can maybe look more at community partnership or we do only have to pick 3 of these activities that we do in each one. So we can also leave off the monthly meetings if this overall still feels like it fits.
Michaela, was there one that you had preference
Mm.
to do of the 2 that weren't the top objectives? Like, was there one that you would like to see more than the other? Because you would probably be the person doing most of the work.
Yes, this would probably fall into the coordinating. I think both are really good goals. I do lean more towards the improved sharing of resources, not necessarily because there aren't good frameworks, but just because for myself, I think it would be useful in establishing the coordinating role, kind of formalizing some of those processes for inventory and um, how we want to go about like requesting resources, like really making sure that works for everyone and making that a goal. Um, so that's my 2 cents, but also I do think the community partnership and development is a good choice as well.
Going off what Taylor said, I'm completely okay with what you think is needed or what you would like to work on, since again, you are probably the one doing it. Um, and I think being behind the scenes of every town, I think you know better than we would anyway.
Mhm.
Maria? Excuse-
So maybe if I'm hearing everyone, we could do the first 2 and maybe Michaela, we can remove the hold monthly meetings and then just so we're not, because we only need
Mhm.
3 activities and then we can make that, an internal goal, but of course people are busy, so I don't want to be, held up
Yeah,
to
I
that.
think that sounds good. I think also like even if it's not necessarily a meeting, like we could just do like a monthly check-in email or something too, if that doesn't work for people.
Yeah, I think just having a way of
But
checking
being
in.
able, I think you're right, being able to develop a process to request either staff or, internal, the items that we have would formalize that process would be good.
Okay, that sounds good to me.
So we can either vote as we go or just vote at the end
Let's
on.
vote at the end if that's okay.
Yep.
Okay,
So I think
so
we'll do number 1, communication and engagement, which I think is always a priority of what we do, and then improve sharing of resources, taking away the hold monthly meetings. And yeah.
Great.
perfect. That sounds good. Okay, and then performance standards. So this is more focusing on kind of those legal requirements of health departments. Um, Again, one thing that came up was tobacco use and prevention, or tobacco use prevention for Boylston and Northborough. And especially with the tobacco control projects coming up for re-procurement in FY 28, making a plan on kind of how to go about that is part of that objective. And again, the racial and equity theme would be ensuring local boards of health understand their role in tobacco control. So this is one that came up. And then for the other 2 options, disease control and prevention, enhancing staff capacity to meet enforcement regulations. So this would be kind of what we've already been doing with the nursing meeting and ensuring we have MAVEN coverage and continuing that. And then also building in kind of that ongoing feedback of what disease control staff needs exist and what might come up. And then there are some specific activities if hiring new staff and making sure that they have training and there's like a hiring plan. And then this third one is essentially a very similar objective, but applied towards environmental health. So again, collaborating between our 4 towns on solving any staffing need or gaps in environmental health, outlining new roles and responsibilities, kind of as those staffing needs change, and then developing an SOP for requesting support, and then kind of we've started to do this, but creating a system for kind of tracking how inspections are going and if we're on track for that. So these are the 3 primary options that came up when talking about the performance standards in each town.
So I will say for Westboro, the tobacco one really doesn't fit for us. For one, we're actually one of the top 4 towns that are really on top of the tobacco inspections. And also we just banned kratom throughout the whole town. So that one doesn't fit for us, but just so you know.
Yeah, I think so. Last year, the tobacco prevention and control was required for any municipalities that didn't have or weren't part of collaboratives. It wasn't required this year, but I think it would help Northborough and Boylston just because we're not part of one. I know Northborough is using MHOA to do the youth compliance check, so I think that could just be, I mean, it's a pretty easy standard, and we could always pick 3 if that doesn't fit everyone, but I think just keeping it there to help us out.
Oh, I totally support that.
I appreciate it.
And
And
maybe
then
we could collaborate with Westboro to learn from your gold standard of tobacco control.
It's difficult. It is. I think I removed 90% of product from one store.
wow. How
Right.
many permits do you have?
21, and we put a ban on how many we're allowed to have in town. And we're actually our adult establishments, once the current permit has expired, we're not renewing them. It's going to be
Lots to learn from you.
Yeah.
Yeah.
I think thinking about disease and environmental health, I'm leaning towards disease control and prevention just because we were thinking about hiring a part-time nurse and possibly we would have more or the nursing software to kind of help us with this work plan. So it seems like we'd have a little bit more resources and information to do that, but again, open.
I was just gonna say, I definitely support the tobacco where we have 2 towns that need a little additional support. I don't have a strong preference either way for disease control or environmental health. So I would defer to someone who has a stronger opinion.
Yeah, I think your plan is works. I'm fine with going what you decide with that as well.
So if you want to do
I
disease
agree.
control, that's fine.
Anne Marie, sorry, what was that?
I agree. What you have planned out for the performance standards is great.
So did you want to do all 3 or just pick 2?
No, the disease management and the tobacco, like you said, because we don't
Okay.
have, that would be fabulous.
Okay, perfect. All right.
Okay.
Then that sounds good.
Yeah, so it sounds like the tobacco control and disease control and prevention.
Yeah, let's do it.
Perfect. Okay,
And now
last
the
one.
fun.
This is the fun stuff. And there's obviously a lot of different electives, but again, this is kind of the pared down list of what seems to fit with our group and kind of what I've heard from each town. The bottom two for maternal child family health and inventory management are things that we did this past year. So if we did select those, that would just be kind of continuing on that work. But then the other options here are access and linkage to care. This one is also partially on here because that was part of our foundational public health service review. This is kind of the area where there's the most room for growth. And this would be similar to the community partnerships of kind of assessing what resources we have, what barriers there are, and ways to kind of partner with healthcare to improve access. Assessment and surveillance, that's the epi side of what I do. So that's using data to inform public health programming. A lot of these things I'm already doing as an epi. And then this third one is chronic disease prevention for the cardiovascular screening. Did want to point out for this one, there are some more like program specific object or activities where we would be doing screenings. But I think this next year it would be a good way to build the foundation for if we wanted to perform those screenings, because it's still, the state is still figuring out kind of some of those logistics. So these activities would specifically be more about setting the stage if we wanted to be more active in that area in future years. So again, open it up to discussion and what feels like it fits best and what each town wants to work on. And for this, we can pick a maximum of 3. We don't have to pick any, but we can pick up to 3.
So I kind of feel like, and again, a lot of this is work that you'd be doing, Michaela, so I don't want to give you a heavy burden, so please speak up if you do think it would be. If we're going to carry forward and it's not a heavy lift, I think we should go ahead and do those 2. Obviously, I'm pretty passionate about maternal child health, so I think that would be important to continue on. Also, as the state is expecting us to enhance those foundational health services. The inventory management is kind of mixed in with some that we already said, and you've already established that, correct? So just be
Yes.
like continuing on and kind of having like that accountability piece to maintain the list, right?
Mhm.
Okay.
Yes, yeah.
And then I don't know how big of a lift it would be, but I definitely am interested in pursuing that access and linkage to care, just so that we have something written down and formalized. Like, I feel like, at least speaking for Southborough, there's a lot of people in town who have a lot of great access and linkage, but I don't know what services they have access to. So I think being able to kind of get all of those like key players together and formalizing that and then being able to do it for our region would be really great.
Yeah. As far as lift, I think the access and linkage to care is definitely one of the bigger
Yeah.
tasks. So if we do that, I think in addition to carrying forward things that we're already doing, that's a manageable workload. I would say if we were going to do access and linkage to care and another new
That would be
objective,
harder.
that would be, I would say we should just do 2 instead of
Yeah.
3.
I would agree with that.
So
But, yeah.
Westboro does this with their, we have wellness clinics. So it's surrounding physicians and nursing and people. We could share that with the region and you guys could do that if that's too much of a lift and we could pick something else. Because I'm sure that they would participate in whatever clinics you, or if you want to make it a regional thing. Just so you don't have to redo that work all over again. I mean, that's an idea as well.
Yeah. Yeah, I didn't realize. I think that would be the cool part of the access and linkage to care is having that central resource to know what each town has. I think it's definitely doable. But just keeping that in mind, if there was anything else we wanted to add, that would be kind of my assessment.
I mean, we have we speak at Parkinson's meetings once a month, but we do hold the wellness clinics at the senior center. But I'm sure, I mean, you guys were more than welcome to have people come, and then we can just maybe switch where
Yeah,
other months.
that's awesome. Who runs that? Is it the
It's
health
Jeff.
department? Jem, okay.
Any other topics that we're particularly interested in?
What's involved with the chronic disease prevention? Is this the BP clinics part of that? So I'm really
Yes.
interested in continuing that.
And this is like expanding that to include pediatric populations. So this wouldn't mean that like if we didn't select this, we would stop the BP clinics at senior centers or in each town. This is expanding that to include pediatric populations and also cardiovascular screenings like glucose monitoring and cholesterol screening. So this is a bigger lift in that respect. But it wouldn't necessarily mean stopping the BP clinics. Does that answer your question?
Yeah, it does.
And I'm not saying we can still add it, but just wanted to clarify. If we don't select it, that doesn't stop.
I kind of see the chronic disease prevention kind of as a mix of number 1 and number 2. Basically, we have to assess and, discuss linkage to care. And then we also have to assess and surveil kind of what's going on in our community. So if we were more interested in like chronic disease specific, I think that could be a good one. Taylor, I know you're uncomfortable with the blood pressure and not blood pressure. What do you call it?
The
Glucose.
screenings.
So I would say we just, as Michaela has it right now, we wouldn't put those bullet points.
What
But
are you comfortable with?
There's a lot of unanswered questions on the state about liability as far as doing cholesterol and glucose screenings, and who the liability would fall under if you had an abnormal result and whoever did the screening did not report it to the appropriate person. I have asked the question a few times, and right now there is no answer from the state in that regard. So I just personally would not, I wouldn't vote for that one, but if that's what the larger group wants to do, that's fine. Yeah. I mean, I think there's other work that could be done in that area, not doing the screenings or, doing the screenings, and I would just probably pass in Southborough for now. But I know a lot of other towns have kind of started utilizing those screenings already. I personally am just not comfortable from a liability standpoint, but I think there definitely is work to be done in that area, and I think we could develop a good foundation for a program while the state is looking to answer those questions. And I would be fine if that's what the group wanted to do, but I wouldn't personally seek that one out this time. But yeah, so.
I think if we were to do that, Taylor, I think we should get an opinion from council because I wouldn't want to create a liability for the towns and get an opinion on that.
Yeah, I think as it is, we already removed those activities from the chronic disease prevention objective, but we can definitely do something else. I think access and linkage to care is kind of on a similar note, as I said, and it was pointed out in the foundational public health services that that was something we were not doing as much of. So
If
sorry, go ahead, Taylor.
I was just going to say, if this is the last section and you wanted to just vote on it, that would be fine. We can start with this one and then go backwards. Or no?
Okay.
Is there more discussion to be had?
No, in terms of work plan, this is the last section of the work plan to decide.
So I think what we're hearing, so continuing maternal and child and family health, continuing inventory management, because we kind of already have that and it would just be accountable, keeping us accountable as we move forward. And then we're deciding one, if we want to do another one, and if we
Right.
want to, which one do we want?
And I think it's between access and someone can speak up, obviously, if I'm wrong, access and linkage to care or chronic disease prevention and whatever the greater group wants, I'm fine with.
Or depending on how much work the other ones we previously chose would be, maybe we don't go with one here besides the bottom two.
Yeah, we could definitely do that as well.
Now, is this something we can change later on if we find that the work prior is not really much to it and there is time to add something from this page later on? Is that a thing or no?
Adding it officially to the work plan, I don't think is possible. I mean, that doesn't, just because we don't select it for our work plan doesn't necessarily mean we can't work on it as a group.
Yeah.
So if that is the case and we have more time and capacity
We could do
and
like an unofficial.
yeah, addition. Um, so I think that could be a good plan. But yeah, in terms of like adding it officially to the work plan, we can make budget revisions, but we can't necessarily make work plan revisions after it's submitted.
I say let's stick with the bottom two.
Okay.
Sounds
Anne
good to
Marie, do
me.
you have any thoughts on the electives?
Well, I agree with Taylor with the cholesterol and the blood sugar screenings because there would be follow-up, and sometimes the follow-up isn't as easy as it sounds. So there's too much gray area there. But I'm in agreement to keep the bottom two as well.
Okay, all right, perfect.
That sounds good.
So I
Awesome.
think if everyone's comfortable, we could take a vote on what we talked about. So maybe Michaela, let's summarize if you want to go back the two slides. So well, the PHE requirements, we have to do all five.
Yeah.
That's required. We can't choose there. And then sustainability, we decided on communication and engagement and improved sharing of resources with the removal of the activity that says hold monthly meetings, and we will continue the communication as we see fits with our group. And then for performance standards, we decided to do tobacco use control and disease control and prevention. And then for the electives, we have decided to carry on maternal, child, and family health, and then the inventory management.
Great. So can I make a motion that we approve the work plan as Isabella just stated?
Second.
All those in favor, Southborough,
Yeah.
Yes.
Go ahead, Chelsea.
Yes.
Jen, Westboro,
Yes.
Anne Marie, Boylston,
Yes.
and Isabella Northborough, yes. All right, so we will finalize. It's on a spreadsheet, and we will send it to the state. Once it's approved, we will send out the entire spreadsheet so you can see all the due dates and all of the things that we need to do this year.
Great. Thanks for going through that, Michaela.
Absolutely. Thank you for contributing to the feedback. So the next item is the FY26 budget. So I will share that as well. So this is based off of what we spent this year carrying forward staff.
Sorry, can you just make the screen a little bit larger, Michaela?
Absolutely.
Thank you.
Yes. I think I can. Give me one second.
So as we're talking about this and as Michaela's doing that, so the next agenda item, I'll just kind of touch base on it. So the contact tracing funds, we were notified that we can continue carrying that carry forward funds until the end of next fiscal year. So we do have that this year, which is a great help because you'll see that some of the things we had all discussed, like the hoarding contract and the nursing software, we can fit that onto the contact tracing grant for next year. And then once metric takes over, we will not have to pay for relevant, so we can kind of add back some of those services as we decide next year.
Nice.
That was a big relief to get that done. So in this budget, anything that's kind of in red is pretty much locked in terms of this is staff or funds that are already determined. Myself and Michael, our salaries, the fringe benefits. And then anything in gray or yellow throughout the budget is things that we can shift around. So we talked about adding the part-time nurse position. This is estimated for $50 an hour at 16 hours a week.
So can I ask
Yeah.
where the $50 an hour came from?
I had looked at some previous or existing nursing positions posted. 50 is definitely the higher end. But I would defer to MAP Jen for, I don't know, Taylor, if you know of any actual ranges.
I would have to look them up and get back to you.
Okay.
Our public health nurse makes 45 an hour.
Okay.
And I'm trying to
I
think
can
what Cheryl makes.
pull up some comps right now. Give me a second.
I know Medfield is hiring a part-time nurse right now.
Needham. I mean, it's a range, but it's 39 to 52. Well, that's first position. Yeah. And then the other one that's posted. Sorry, I have to do some quick math. The other one that's posted is 40 to 45.
Okay, so 50 is definitely on the higher range. I think we just added it just to make sure we had enough funds, but
I mean, obviously it's your choice, but I was just wondering.
yeah, or we could say, up to 19 hours. I mean, I think that is just there for kind of how we see it and how many applicants and what their work experience brings.
So that's the salary portion. We can kind of, and this can be edited if there's other areas we want to add more funding to as well. So other program costs, we have the salmon contract, which is for 30 hours a week. And that's Penny and Celeste. And then we have health communications. This is just kind of roughly what we had budgeted for last year. And then we have inspectional supplies, membership fees, nursing supplies. Again, these are all calculated based off of roughly what we spent this year with a little bit of wiggle room built in, especially for inspection supplies and nursing supplies. Technology and hardware. This is the relevant contract. Office supplies. Again, this is based off of this year. And then travel reimbursement is kind of what this section covers. If you want to just go section by section, any edits or comments kind of about the amounts as assigned.
Do we find that the cost for translating and printing that's enough? Because I do think it's important, and with us moving forward with trying to do more, is that enough?
Yeah, so I think if that is over, which it probably will be, to be honest, over that health communication line item, we would use contact tracing for remaining translation. Or if we hire the nurse at a lower cost, or we kind of evaluate mid-year, I think that is important.
Yeah. And then,
And the nursing supplies is pretty high, so we might not use it all, but we, in the last 2 years, have spent close to $3,000 a year for the EpiPens. So we definitely wanted to make sure that was included.
and the technology and hardware, we budgeted the same amount for this year, and didn't use it, but it's good to have. So again, we could flex that into health communications, office supplies. I don't think we got close to spending $1,000 on office supplies. So there is some flexibility with those areas as well. And then travel costs. Anything else though? That's a good point with the health communications.
No, I think it looks really good.
Perfect. And then these last couple of sections, these are kind of, again, the admin support is a locked in 15% rate. Facilities operation is like the office printing and stuff that we do in Northborough. And then this is one that we can talk about with the training and credentialing. We increased this from what we planned in FY25, especially if we're going to hire another person, having the ability to send them to conferences, things like that. This is roughly what we budgeted. I think we spent close to this year. I don't remember the exact number, but I think it's like 10,000 or so. So any thoughts?
So just to clarify, this is this saying now that we wouldn't be able to send staff that's not part of Greater Boroughs through this line item?
No, so
This-
we kind of just budgeted what it would be for our shared staff because we have to prioritize the
Yeah,
staff
of
we
course.
hire. But no, so that would only be 6,000. So then we would have 4,000.
Okay, I just wanted to make sure that I was reading it correctly. Yeah, that sounds
Yeah.
fine.
And this would also be like, if obviously if municipal budgets won't cover it like that, we would
Right.
opt for that to be the first option, but if it
Okay.
doesn't, this
All right.
grant is to support that for
Yep.
municipal staff.
And then again, contact tracing. Again, I know that's just for one extra year, but
Yeah. Okay.
It's gonna be sad when that leaves.
I
I
know.
know.
Okay, so now that we've kind of seen the whole thing, this is budgeted out to the cent within contract.
Wow.
So if there's any edits, this is a living document, so once we submit it, we can edit it throughout the year as hiring timelines change, or if we want to add more to health communications. But for the time being, to get us started in FY26, are there any other edits that we want to make before approving budget?
I move to approve the budget as written.
Second.
All right, all those in favor, Westboro,
Yes.
Southboro,
Yes.
Boylston,
Yes.
Northborough, yes, amazing. So now we have a fully completed work plan and budget for FY26. So thank you, Michaela, for all that great work.
Absolutely. We don't have to have an extra meeting.
And then I kind of touched on this, but the contact tracing, so that is, we have, I think by the end of the fiscal year, it'll be like 220. And we will have to spend it by next end of June. So some ideas that we had talked about, the ClearPath contract, nursing contract, per diem for Sam and VNA nursing, which they did reduce that by $10. So it's now $65 an hour. And we would only use that for like breastfeeding classes, things that our nurses probably wouldn't have expertise in. And then we can talk about this as we go throughout the year, but a strategic assessment or plan, expanding our sunscreen program. I just did an order for sunscreen, thinking about AEDs, health promotion giveaways, trainings. So there are some items that we can kind of think through to spend down those funds.
Isabella, are the AEDs approved to be spent through contact tracing?
They are, yes.
Oh, can we please do that?
yes, we can touch base with all of the towns to see if and where they want them.
Yeah.
That would really need to be a collaborative part because we wouldn't be checking the AEDs.
Okay.
So we
And
can,
also the health promotion giveaways, I know that there's been discussion of, I'm sure surrounding towns as well, about the health department putting together something for fairs and things like
Mhm.
that. Do we have, can we use that stuff for that? And
this
there-
grant is definitely more flexible than PHE. So I would say yes, and then we can submit to Hillary, who manages the grant, to see if it's allowable.
And the other question is, do we have a staff member that'd be able to attend those or no?
I think between our shared staff, if we have enough time, yeah. And I think that would actually fit into our first
That's what I was
work plan
thinking.
objective.
Yeah.
So I think,
Yeah.
I think that's a great idea. I do think we have a tablecloth, but like working on like the giveaways and whatever tabling stuff.
Would you say the first part?
We have a tablecloth.
Oh, okay.
And I know with PHE, if you are strategic about how you ask for things and what you include with giveaways, like if you include public health education materials, they'll approve some of them. Like I know people got tick removal kits in another town. So we can definitely look at having that for theirs, and I can be one of the staff members that attends.
All right. Do we want to, so if everyone's okay with this, I will renew our ClearPath contract. I think we should vote on that.
I move to approve the clear path and continue the contract for 4 hours a week.
Seconded. All those in favor, Westboro,
Yes.
Southboro,
Yes.
Boylston,
Yes.
and Northborough? Yes. Okay, so we will do that. And then did we want to decide on a nursing software? Are we still interested in that? I know that was a
You received
conversation.
all the, yeah, I think you received all the feedback to make that decision.
Okay, so I would just vote on it here. So my senior center or my Juno. Anyone have a strong opinion?
I don't even remember what the one that we liked better was at this point, honestly. Did you remember?
I think both had pros and
Right.
cons. My Juna's a little bit more expensive, but definitely more modern, and has a little bit more nursing components. And then my senior center, obviously it wasn't made for a health department, but has a lot more like scheduling and signups for programs, and both had similar reporting. We are meeting in July, early on in July, if we want to wait and vote on that. I just wouldn't want like it to be halfway through the year.
I'm fine with voting for it now if you remember the feedback. I don't, Jim was fine with either one.
I also think my 2 cents
Yeah, please.
is it's gonna be a temporary software
Right.
anyways. And I think in terms of speed and efficiency, my senior center might be the better option because it's already implemented in, I think, Southborough and Northborough. So as far as like an IT perspective, that would be easier. And the communication side, I think, aligns with our goals of increasing engagement and that side of things. And the reporting was, I think, sufficient for what we need it for the time being, would be my vote. And not that I have a vote,
So
but
is this
my
one-
thoughts.
Is this the one that you have to make appointments with, or you do make appointments with, or is that the other one?
I think both you can make appointments with.
I think I'm
if
just a little
remember right.
concerned. Is it the seniors that is responsible for making the appointments on on a website or an app, or is it the staff that's going to be making the appointments?
I think it's the staff.
Yeah.
All right.
I think we need to wait to make a decision and
All right.
review. Sorry.
No,
We
that's
can maybe
fine.
add
And-
that to the July agenda and I can recap and
Thank you.
do some details.
All right, that sounds good. But I will get the ClearPath contract and the Salmon VNA contract completed for the start of July. And then I think at the beginning of July, that fiscal year, we can talk about the plan for hiring the nurse as well.
Great.
All right. Anything else as we I mean, we'll see each other in a month, but
Do we need to approve the meeting minutes and
Oh,
confirm
yes.
September and July meetings?
Yes. I don't have a slide for that, but yes.
Oh, okay.
Did anyone
I
have any
make
edits?
a motion to approve the meeting minutes as written.
I'll second.
All those in favor? I guess we can, oh, Southborough. West, Southborough,
Do you
Yes,
want me to do it?
sorry.
Westborough. Westborough, did you say aye?
Yeah, that's fine. Yeah.
Boylston?
Aye.
Northborough, yes. Okay. Meeting minutes approved. Thank you.
Cool.
We don't have to talk about it at this meeting, but just for future meetings, like I kind of like this early morning time
I do too.
if it works for people. If they'd be open to changing it, like maybe going forward, like we can keep our scheduled meetings, but going forward, we change it to an earlier time. I would like that, but obviously
I agree.
to everyone else.
I think that sounds good.
Sounds good to me.
An early morning, 10 a.m., but
Good morning.
So our
No.
regularly scheduled meetings are, what is it, the second Thursday of every other month. So our next one is July 10th. Do we want to just move that to 10? Keep the same week and day?
Elsie, do you have problems with that for your schedule or?
Thursdays are okay. I mean, the summers, who knows, like,
Right.
if you can do the 10th, that's probably good. If I can't. But normally Thursday mornings are fine.
Okay. Yeah, I
Anne
can do
Marie,
it.
how does that sound?
Second Thursday of the month, July, Thursday, that's fine with me, 10 a.m.
Okay.
Wait. I will say the only thing is that sometimes the monthly MAPHN meetings are usually the first or second Thursday of the month, starting at either 11 or noon. I don't have any on my calendar right now, but do you want to just see how it plays out and then I can let you know?
Yeah, so let's do July 10th at 10 a.m. and
Yeah.
then let's plan the September one and then we'll revisit in September.
Yeah, that sounds good.
So then September we have,
Right now, the 11th.
can we do the September 11th at 10 a.m.?
Yeah.
All right, perfect. Michaela, you'll have to, well, I will send out a calendar invite to update that and then Michaela will send it out in the email.
Great.
Awesome.
Thank you.
All righty.
And then we just have to adjourn, right?
Mm-hmm.
I move we adjourn at 11.
Second. Boylston,
Yes.
Northborough, yes. Southborough,
Yes.
Yes.
Westborough.
Oh, yes. I'm sorry. Second time I did it today.
Thank you.
All the O's.
Thank you
Thanks,
all.
everyone.